Okay, hello everybody watching. My name is Dominique Douglas, and I'm just trying my best to explain how my vision works with RP, I believe is what I have, Retinitis Pigmentosa, and it's pretty chaotic and crazy as you can see here. I finally worked out a way to kind of record and demonstrate kind of what it looks like for me. So I've worked a little bit of family that were able to assist me, and essentially everyone's vision normally is like this. It's just clean, clear image, and my vision has a lot of different crazy obscurities happening between these very light glowing C shapes that will kind of motion upward and at an angle always and kind of curve away and split into two, sometimes three, to strange kind of like oscillating, um, kind of vibrating almost things from the corners of my vision towards the center, and then like they fade as they go to these more really what's causing most of my problems right now with work, these orbs that kind of float in the way of things that I'm trying to read, and they move very slowly, like such, just very slowly. And if I strain really hard, they'll kind of push out of the way, but I maybe get like a glimpse as to what actually is being said there. Now, so far working with Dr. Yesnik, really appreciate you taking time. I'm hoping this will help explain to you exactly what's wrong with me, what's going on, what I'm trying to talk about here, in terms of my issues that I'm having. So without my glasses that you've given me, I would say my blurriness was about this level, pretty intense. Now, if you go further and further out, it gets worse and worse for me. But what the glasses did for me, which is awesome, is they made the text clearer, right? Essentially, and that's amazing. Now that helps because if these orbs come through, I can still make out pretty well what it is that's there. But keep in mind the text is usually a lot smaller than this on a computer screen. So it does help. Don't get me wrong, the glasses help, absolutely. But it's not solving the problem with all this stuff floating around and vibrating and going crazy in my vision, which can be really frustrating to try to deal with through the workday. And more than anything, it's straining my eyes out because I'm trying so hard to focus. So my request is to take intermittent time off for whenever I get headaches and migraines from trying to focus so hard for these orbs to move out of the way and read the text that's behind them. Now, I very much love my job. It's excellent. I love to help people. It's fun, but it's definitely putting a strain on my eyes and it's hurting my head. And so far, what you've tried to have me do is wear these glasses, and that has helped. But I wanted to make you understand that any kind of like shades or anything you put in my glasses doesn't help because it's not going behind the obstruction. It's not going behind it to help. It's actually going in front of it like this. And do you see what that does? It makes it even worse. It makes it worse than it was before because now it's acting like a backdrop for all the crazy circles and colors and stuff that's moving around all the time. And it affects me different ways. So this is if I'm wearing sunglasses. If I were to close my eyes, it essentially looks like this. It looks like I'm looking at galaxies in space, except everything's moving. It's not still like this. I did my best to try to explain what it's like. But yeah, it's absolutely it's chaos, and it's been this way since I was a kid, and I've learned to deal with it and focus better, and it gets slightly worse certain aspects as I get older. But yeah, as you can see, it's not really helping to add shades, and that's why I was getting kind of bothered at the appointment when you kept telling me to wear different shades and things like that because I'm not trying to be difficult with you, it's just it doesn't work. And so different aspects I've kind of demonstrated here. So like if it's an overcast day, it kind of just makes everything muddy. So days that it's really cloudy outside is kind of what it's like. During the golden hour, when it's like 5 to 6 o'clock, it looks like this. And then computer screens, when the blue light's on, it looks like this. Now, what I do to try to prevent strain and what helps with my headaches is I put the computer on night mode. So I go to my settings, whatever I'm working on. There's a nifty night mode in Windows settings, and it'll switch to this nice warm color that doesn't make my eyes strain as much. Now the trade-off is that it doesn't hurt as much over the course of time. However, it's doing this effect again where everything is kind of bled out. So it's always this weird trade-off. If I try to put a screen on, if I try to change things, it's really finicky how this whole thing works. And so my only solution I've come up with is just to take time just to rest because these orbs, these things that are in the way, all of the vibration, all the craziness that's going on seems to lessen when I'm not straining my eyes and working harder. Now that time frame for me, when you were offering through the latest accommodation, I think Amanda it was, to give me the 15-minute breaks for those, I'm down to try anything, whatever works. I just want to make sure that I'm not in pain with these headaches because they're horrible by the end of my shift, and I want to make sure that I can continue to do my job because it pays well and I love doing it and it's a good time. And I realize this is an inevitable, sorry, where I'm losing my vision, but I want to explain this is what it looks like, okay? This is exactly it's pretty accurate as to what it looks like. And I have a little bit of background with graphic design. That's how I was able to use Photoshop here to kind of demonstrate, but I wanted to make it extremely clear how different things are affecting me in terms of helping or hurting. And what it is that I'm asking for is just straight up just time for my eyes to rest so that I don't I don't have the pain. Now, me working with this agent at Bank of America, she's asking for specific information like time frame, like how long do I need accommodations for? Even if it is a indefinite disease and problem, we still have to put a time frame, I guess, for technicality reasons. I don't know why. But yeah, I hope that this demonstration kind of explains, as crazy as it sounds and looks, like this is my everyday, and it's tough, but I want to work through it. And so far I've been doing pretty decent at my job, and I'm proud of that, and I just need some help. So yeah, yeah, I want to build a relationship with Dr. Yesnick and Amanda Stevens, I think your name is, if you're a doctor as well. Thank you for your time. And my whole goal is to demonstrate both what this looks like and try to work together to try to make the best use of what I do have available for vision to live as close to a normal lifestyle as possible. So anyway, thanks for your time. Take care.